not trending downward. We're continuing to watch that regularly and are encouraged by what we're seeing in our community. So we want to make sure that we recognize the fact that things are improving at this point in time. In terms of vaccines, our county is 42% partially vaccinated, 35.7% fully vaccinated. I will recognize at this point the data that has been displayed by several media outlets that looks at census tract data. I want to point out, number one, that data is a bit out of date. The data that they are using came from late April, so we know that things have changed some since then. I also want to point out that what we've been asking for from the state is ongoing data so that we can continue to analyze these situations. We are looking at this and mapping it, but I've got to tell you, when the data is that far out of date and things are moving as quickly as they are, it's difficult for that to really give us a good picture of what's happening in our community. I will say that what we see on those maps is not surprising, and it's what we've been talking about since the beginning. COVID has disproportionately affected certain populations, whether that's in number of cases or deaths, severe illness. In addition to that, we're seeing the same thing with our vaccines, is that those populations are underrepresented in the vaccines that are being given out in our community, and we've been trying to pay attention to that for quite some time. So as we look at it, we recognize that our younger populations are less vaccinated than our older populations, and that our historically marginalized populations are less vaccinated. And in the locations where they live in our communities, that's what we're seeing. What I will say is that we do also know that we have been providing, both ourselves as well as both of our healthcare systems, lots of clinics in those areas, and we're mapping that as well. We'll make that information available as we can. But the main purpose for the data for us is to help us analyze our situation in our county and make sure that we are developing our plans in a way that address what we're seeing in that data. So we will continue to stay on top of that as we can. But at this point in time, what we are getting is downloads of data from the state, not having access to our ongoing data here in Mecklenburg County. So we will make the best of what we have, but just understand that what that means is quite often the data is outdated and not up to date. The really good news is that we are now able to provide vaccines to 12 to 15-year-olds in our community. Pfizer is available to 12 to 15-year-olds. Both of our healthcare systems, as well as the health department, will be providing those vaccines. And we are seeing lots of interest in the clinics that we've had today. The people are showing up with their 12 to 15-year-olds to get them vaccinated. That is great news. So we want to continue to encourage everyone to be vaccinated, but especially that age group at this point, since they're now eligible. You've also heard that the CDC has recommended the ability of people who are fully vaccinated not to wear a mask indoors as well as outdoors. That also is great news. The data that they have, the studies that have been done, are showing that the vaccines are very effective and are also proving to be fairly effective against the variants that are out there. So that allows the CDC to make that recommendation. And we're supportive of that, and we are pleased to see that happening. I do need to point out, though, that in North Carolina, we are still under the governor's executive order. And at this point in time, that requires all North Carolinians to wear face coverings in public places while indoors. So I expect that the governor will change that executive order fairly quickly now that the CDC has made these recommendations. But at this moment in time, we are still under those orders from the governor. The point that I want to make about masks is the CDC guidance, based on research, based on data, shows that we do not, if we are fully vaccinated, need to wear masks around other people. That means you have to be fully vaccinated to be safe. and not to expose other people in our community. So I hope people are listening to this, and I am strongly encouraging everyone to go out and get vaccinated this weekend. There are multiple clinics available to you. Vaccine is readily available to you, and different vaccines are available to you. So if you like the idea of not having to wear a mask indoors as well as outdoors, please take full advantage of these clinics this weekend and get yourself vaccinated. That is the answer as we move forward. CDC has been clear about that. So hopefully everyone will heed that and will take this opportunity to get vaccinated this weekend. So with that, I'll turn it over to Dr. Sullivan.
Thank you, Gibby, and good afternoon, everyone. I first just want to echo Gibby's comments about really encouraging everybody who is not yet vaccinated and who is now over the age of 12 to get vaccinated. We know vaccines are safe, vaccines are effective, vaccines save lives, and we need to get everybody vaccinated. I also do want to just echo Gibby's comments that we are incredibly excited about the FDA authorization and subsequent CDC recommendation to provide the Pfizer vaccine to adolescents aged 12 to 15-year-olds. We have noted these recommendations are based on very strong science and data about the safety and effectiveness of the vaccine in this age group. And Mecklenburg County Public Health began offering the vaccine to anyone ages 12 and older at our clinics today, and will continue to do so going forward with both appointments and walk-in slots available. We also know that multiple enrolled providers throughout the county are offering the Pfizer vaccine to persons 12 and older, as well as the Moderna vaccine and Johnson & Johnson vaccine to 18 and older. As Gibby said, vaccine is readily available, and please go get vaccinated if you haven't been. We are really hopeful that the new recommendation around 12 to 15-year-olds will increase the number of individuals who are vaccinated in the county, and as a way of further reducing the spread and impact that COVID continues to have here. In preparation for this recommendation, we have been working on several strategies to ensure that equitable access to the vaccine throughout the county extends down to this age group. And so as part of our ongoing efforts to provide outreach, information, and vaccination opportunities throughout the county, with a particular focus on populations disproportionately impacted by COVID and those who have ongoing challenges accessing the vaccine, we will continue to offer and ensure vaccination opportunities at prioritized and convenient locations throughout the county. A particular note, I want to highlight an event that we have this weekend on Saturday, May 15th from 12 p.m. to 4 p.m. at the Movement School on Central Avenue, in partnership with Commissioner Jarrell, with Novant Health, Cardinal Innovations, Walmart, Pride Magazine, and Freedom Fighting Missionaries. We are really hopeful we can get lots of individuals ages 12 and older vaccinated at this event. We also continue to be highly engaged in provider outreach to increase the number of enrolled providers who provide the COVID vaccine, with a specific focus on census tracts that have a low vaccine uptake and high social vulnerability index, and on pediatric providers. We'll also be relying on our school nurses to provide accurate information to students, staff, and parents about the vaccine as we work to get our adolescents vaccinated, and have been in communication with CMS about various opportunities to provide the vaccine at school sites for students, staff, parents, and the community members. And in particular, we are working with CMS, both of our hospital partners, one of our federally qualified health centers, and at least 2 community vaccine providers to be providing multiple vaccination events at CMS schools throughout the county next Saturday, May 22nd. And we look forward to sharing more details about this coordinated event next week. Of note, I also want to take the opportunity to remind everyone of our homebound vaccination program, which will now include the option to provide the Pfizer vaccine to homebound adolescents ages 12 and older, as well as their caregivers and others in the home. And we really encourage parents or guardians to submit a request or reach out to us with more information. And finally, I just wanted to briefly highlight another CDC recommendation from yesterday's meeting that now allows for the co-administration of other vaccines at the same time as receiving the COVID vaccine. And this recommendation will be critical as part of our efforts to ensure children are up to date with their other routine immunizations prior to the fall, while continuing to provide the COVID vaccine at every opportunity. And finally, I'll just close again with Gibby's comments around, we know the vaccine is safe, we know the vaccine is effective, and we really need to get everyone vaccinated. Thank you.
Thank you, Dr. Sullivan. First question today goes to Hunter Science, WCNC.
So it sounds like some pretty exciting news coming from the CDC. Of course, no changes here yet. I know you said they could be coming soon. And when they do, I want to ask, are you concerned at all because masks and vaccine have become so divisive? Are you concerned that people are going to just lie their way through in order to drop their mask, even though they aren't vaccinated? And if you are concerned, what could that do to our COVID numbers?
Hunter, that's a great question. You cannot tell by looking at someone whether they've been vaccinated or not, right? You just can't tell. They don't look any different than someone who's not been vaccinated. So, we are trying to stay focused on encouraging everyone in our community to get vaccinated. That is what's going to make the difference. And we're trying to appeal to people's sense of right and wrong. We need people, if you're not going to get vaccinated, if you're not comfortable with that, if you're waiting to get vaccinated, if you've not had the opportunity to be vaccinated, please continue to wear your masks. You need to make others safe in our community by making sure. I recognize there's some people who will not be vaccinated, who will not wear their masks. And so we all have to think about what risk we're willing to take in our community as we move forward with this. But I'm hoping that being able to not wear your mask in settings is incentive to people to get vaccinated. The impact that this is going to have on our numbers over the next month or so, we're just going to have to watch that and see. As I said, we've got a little over a third of our population fully vaccinated at this point. We need more than that. But I also recognize that 23% of our population is between the ages of 0 and 17. So we do know that there's a percent of our population that can't get vaccinated, those children under 12. But the 12 to 17-year-olds, hopefully we'll see a good bit of vaccination happening in that age group over the next couple of weeks as well, which will help get our numbers up. So again, we know the vaccine is effective. We know the vaccine is safe. There's lots of information out there that people can read that can help them understand that. We're more than happy to talk to them on our hotline or to come to our clinics and have a discussion with someone at the clinics. But we're just strongly encouraging everybody to get vaccinated so that we don't have to worry about those numbers going up over the summer.
Next question is Derek Dellinger, Fox 46.
Hey, thank you for taking my question. In regards to specifically, a lot of us remember when the pandemic first started that sometimes the county had somewhat more stringent guidelines than the state, and the state kind of had more stringent guidelines than what was being federally put in. Are you anticipating any of that heading towards this new guidance once it's enacted? Do you anticipate anything possibly on a more local level taking place as far as more stringent guidelines, especially when it comes to an indoor mask mandate?
I don't anticipate that we're going to do anything differently than what we see in a governor's executive order. Again, at this point, we will continue to recommend that if you're not vaccinated, that you wear a mask, regardless of where you are, that you need to be wearing a mask if you're not vaccinated. That will be a recommendation, that it will not be a requirement, that will not be a mandate. I don't anticipate doing anything differently in the county as long as our numbers are continuing to move in the direction that we are seeing right now. And as long as we are seeing increased numbers of people being vaccinated, I see no reason for us to do anything more stringent at this point.
Next question, Claire Donnelly, WFAE.
Hi there. Thanks for taking my question. I am wondering if you can give me an estimate of how many children in this new age group the county vaccinated today. Doesn't have to be exact, but like a ballpark.
Yeah, I mean, I think that's something we can provide later. I do know as of about noon today, over 50 individuals in the 12 to 15 range had been vaccinated at Bojangles. We had vaccinated just a handful at the events we're doing. I think Novant mentioned that they had done around 40 yesterday evening. They were both vaccinated today. So I don't have a specific number, but we definitely know that there is interest and we are excited to be able to start it today.
Next question, Drew Balia, WCCB.
Hi, this goes back to Hunter's first question and your response, Gibby, about people being able to sort of just lie their way through, and you can't really tell if somebody is vaccinated or not just by looking at them. So do you envision any sort of proof that businesses or government agencies, offices would have to ask for in order to allow people to come in maskless?
That's a great question. There's been a lot of discussion about a vaccine passport for any number of situations. I don't anticipate that county government will do anything like that at this point. I have no idea what businesses will do. Obviously, they have the ability to make their own decisions about whether they would require proof for entry. So it's going to be interesting to see how people manage that. I've heard of situations in other parts of the country where different entities have allowed unvaccinated people to come in, but they're sitting in a different, whether it's a ball field, they're sitting in a different section and have to be more socially distanced than those who have evidence of being vaccinated. So I think we may see some of that as time goes on, but I really don't anticipate that we're going to see a lot of that. I think it's a challenging thing to implement. And I really don't have any indication that we'll see that around here at this point.
Gibby, quick question. I know you said that this is great news as far as the CDC's recommendation on this, but in your opinion, is Mecklenburg County, looking at the metrics and the vaccination metrics as well, in your opinion, is Mecklenburg County ready for loosening masks for vaccinated people, no matter the setting?
That's a great question. I would love to see more people vaccinated than what we have at this point in time. But at the same time, I know that we have a lot of people who are tired of wearing masks and tired of the other restrictions that are going on. The reality is, over the past year, we still have other infectious diseases in our community other than COVID. I know there's been huge focus on COVID, but we have had probably the easiest flu season that over this past year, because people were wearing masks, than we've had in years. So we know what the benefit of wearing a mask is if you're potentially infectious or haven't been vaccinated. So I'm hoping that people will use good common sense around this, Hunter, and I'm hoping that that we're not going to see reckless behavior because of this. This is great news. This is an opportunity for our community to open up more and for people to be more comfortable in our community, as long as we don't take advantage of it. So a lot of how this rolls out is going to be up to our community and how we handle it. Number one, how we increase the number of people who are vaccinated. Number two, how people who are not vaccinated continue to wear their masks. And number three, how people determine the level of risk they're willing to take in our community. So we'll have to see what happens. But all this year we have been dependent on, and I have been pleased with the response we've gotten from our community around the things that we've asked them to do. So I'm hoping, again, that our community will respond in the way that they need to, and that we'll see our vaccination rates go up.
Drew Belia, go ahead if you have another question.
Thank you. I know we just got this guidance today, but have you all put together any sort of plan or guidance for CMS for if and when the state's mask guidelines come in line with the CDC recommendations?
No, at this point, as you said, this just came out today. So and that it was not like there was a long drawn out possibility that this was coming. It just came out today. So we really haven't had that chance to have that conversation with the school system. We will be following up with them on that. But the other thing that we need to recognize is that, the school season is almost over. And we're moving into summer and summer camps and those sorts of things. So we'll be having lots of conversations around what this means and how best to protect our children as we move through the summer. But it's going to be a whole lot easier as 12 to 17-year-olds get vaccinated. So we will be working with CMS on that, I'm sure.
And I think I'll just add two quick things. The first is that the CDC on the kind of post-vaccination provider call last night did say that they are working to update their summer camp guidance with a particular focus on vaccinations for those adolescents that are vaccinated. And again, I think just another reason to really encourage parents to talk with their kids about vaccination and bring them to get vaccinated. And again, I think the same thing will happen with the school guidance. But the other thing is just a reminder, while we're really excited that 12 to 17-year-olds can get vaccinated, that kids under the age of 12 still cannot. And as Gibby mentioned, that still does make up a sizable percentage of our population. So another reason for anyone over the age of 12 to get vaccinated to protect those that can't.
This is Derek with Fox 46. Okay, good. Go ahead, Hunter.
A quick clarification, Gibby, on the data that you are getting very slowly from the state. Is that just the zip code vaccine data, or is that also data for COVID deaths, hospitalizations? Which one is it that you're getting at a slow rate?
Thank you for clarifying that. The data that we're having a little bit of a challenge accessing at this point is the vaccine data. It is in the state system, and what we have asked for is direct access, ongoing access to the data for Mecklenburg County out of that system. At this point, they've not been able to provide that. What you've seen on the maps that came out today is a one-time data dump. Basically, it's a database where they give you a specific chunk of data up through a certain date. What we're looking for is that ongoing daily data that allows us to really analyze and assess our situation better. So we're still working with the state to try to access that. But at this point, we still don't have access to it.
This is Derek with Fox 46. I have two questions, and they're both kind of level with me questions here. How surprised were you by this guidance this afternoon? And also, you mentioned the importance of getting vaccinated. And the past couple of conversations we've had involving all this has been the fact that these vaccinations are in a bit of a free fall right now as far as the ones that are actually taking place right now. Level with me on both of those. How things look in terms of vaccinations right now, and how surprised were you by this news today?
Well, I heard Dr. Fauci this morning say that he thought it was a good idea, so I figured it was coming. It wasn't surprising when the CDC came out with it this afternoon. And I do know that there's been a lot of discussion that's been happening at the CDC and at the federal level about masking. There's been a lot of conversation across the country, school systems wanting not to require children to wear masks. So I know it's that conversation's been in the ether for a week or two. So it's not terribly surprising. That it came out this afternoon was surprising. We weren't expecting it, but there it is. In terms of vaccinations, yes, we have seen a reduction. We've also seen an increase in the availability of vaccine. So we've got plenty of vaccine. The urgency to be vaccinated that we saw in the early days has gone away. And that was when vaccine was in scarce supply and everybody wanted it at once. So that urgency and those long lines of people wanting vaccine, those waiting lists that we had and stuff, sort of became something we expected because that's what happened. And then it just sort of fell off as more vaccine was available. And a lot of those folks who felt that sense of urgency got vaccinated. Now we're in a stage where we have people who are still interested in being vaccinated, but there's no urgency. And so they're looking for to get vaccinated when it's convenient, when they don't really have to put out a lot of effort to do it. And that's why we're doing the best we can to get vaccine out into the community in lots of different settings. But then there's the whole other group that's sort of on the fence around these vaccines. They're waiting to see how other people do with the vaccine. making sure that they're comfortable with it. And that's the other population that we've really got to put some time and energy into. That's why we're working with organizations to do canvassing in the community and getting the word out and letting people have conversations with folks that they're comfortable with and that they trust, to make sure that they're able to have the conversations they need. So we know we've got work to do to get vaccines to the people that need them the most, and do believe that having access to good, solid data on an ongoing basis will allow us to better do that. And that's one of the reasons we continue to request the data. But also know that we're making it available in places where we know the vaccine uptake has been low, and continuing to try to make it available in those settings. But again, it's going to take more than just making it available. And we recognize that too, and are looking at lots of different strategies to try to make that happen.
Next question, please. Any further questions? Go ahead.
I've got another question. Yeah, I've got another question if no one else is going to ask. You mentioned that you expect the governor to change the executive order quickly. Have you gotten any guidance whatsoever from the state that might indeed be happening, or have you been aware of any discussions that might be happening on that should this news have come down?
No. Again, I think it was probably as much a surprise for them this afternoon that this was announced as it was for us. They may have had a little more notice than we did. The governor had planned to amend the executive order at the 1st of June anyway. And I'm not sure how far he would have amended that, but there was a plan to amend that anyway. I would imagine he's been fairly much in lockstep with the federal government around his executive orders recently. So I would not be surprised. I guess that's the point I was trying to make, is I will be surprised if he does not make an amendment to the executive order based on what the CDC's guidance was that came out this afternoon. And I would not be surprised if that comes later this week or early next week. That's just based on how he's responded to those sorts of changes and guidance from the federal government in the past. So that's just my opinion, my thoughts on the matter. I don't have any specific information that tells me that that's what's going to happen.
And one more thing, just to kind of reemphasize this point here, just because these mandates might be going away or this guidance might be changing, businesses do still reserve the right to make their own rules, at least in this circumstance, correct?
Absolutely. And, as I said, there may continue to be some specific recommendations on certain environments around masking that may come from the state, may come from us, based on what we're seeing in our community or what the state's seeing as a whole. So there may be some recommendations, but, there's a difference between recommendations and a mandate.
Sullivan, I have a quick question here, and I'm sorry for pushing you on this, but I know details are to come about the CMS schools and vaccination clinics that are happening at them. Could you give any further detail as to which schools, or can at least say what is going into the decision-making of the locations, and will they be in different communities around town? Just some more specifics.
Yeah, and we're finalizing all of those specifics, and we'll provide specific details as soon as possible. What I will say is, obviously, we've been working very closely with CMS and have largely been relying on them to choose the locations. I think we are in lockstep with them around our vaccine equity plan, and often their focus on and really good knowledge of the communities and students and staff, and really choosing locations in prioritized zip codes or in places where the vaccine efforts would have the most impact. But we are relying on them to choose those, and also to make sure that they are located throughout the county so that there's coverage throughout. Again, those locations are being finalized, and we hope to be able to provide those details in the coming days.
Next question, please. Any further questions today? Thank you, Dr. Sullivan. Thank you, Director Harris. We'd also like to thank our American Sign Language interpreter, Richard Hafner, for his work on broadcast today. Thank you and have a great evening.